Now that we've achieved the comprehensive stroke designation, MedStar Franklin Square is the best place for patients to go to receive stroke care because we have a dedicated commitment to our community to provide the highest standard in healthcare from one day to the next.
At the state and national level, there are several tiers and designations of stroke certification. Comprehensive stroke certification is the highest of all those tiers. It takes a lot of work to get here. It is no small task. MedStar Franklin Square is the third hospital within MedStar Health to earn Comprehensive Stroke Center designation, following both MedStar Georgetown University Hospital and MedStar Washington Hospital Center. Together, we provide life-saving stroke care across Maryland, Virginia, and Washington, D.C.
From the Maryland Institute of EMS Services, also known as MIMS, we are officially designated as a comprehensive stroke center. This certification from the Joint Commission allows for MedStar Franklin Square to be recognized on a national level as a place that provides excellent stroke care.
MedStar Franklin Square Medical Center being designated as a comprehensive stroke center is really indicative of the quality and sophistication of the care that we're able to deliver patients in our community, both when they have blood clots in and around the arteries of the brain, preventing blood flow, as well as when there's been bleeding in and around the brain. Both of those scenarios require often tailored and complex treatments, which we're able to deliver at the highest quality and in a timely fashion.
We have access to the most advanced imaging, the most advanced procedures, and the largest selection of specialty providers, including neurosurgery, neurologists, stroke doctors, epileptologists, and therapists to make sure that we're providing the best care possible.
Stroke is the equivalent of a heart attack of the brain. Every minute that goes by that part of the brain is not receiving normal blood flow, millions of brain cells are dying. For this reason, it's really imperative to get to the hospital as fast as possible, and this is why we live by the dogma of time is brain.
From the second that you arrive, we have two main focuses. One is to determine why you had a stroke so that we can prevent future strokes. And the other is really about getting the patient on the path to recovery. Both of those processes are happening at the same time because we know that the sooner that you get out of the hospital and start your dedicated rehabilitation, the better outcomes that you have.
In the emergency department, we collaborate with emergency medicine services, our paramedics in our community, and they alert us when a stroke is coming to the emergency department. And we're all prepared to meet that patient when they arrive. We are met by the neurologist and the ED physician, and they're looking at the CAT scan in real time to see if they qualify for treatment, which is either a clot-busting drug or neuroendovascular treatment to go in and obtain and get the clot. So at that point, if they are a candidate for the clot-busting drug TNK, we actually have that medication right in the CAT scanner so we can deliver it right away. If there's issues with blood pressure or other things like that, we have that medication there as well.
If it's determined that the patient needs to be admitted to our hospital, they can either go to our med-surg stroke units and/or our neurocritical care units. At that point, patients will see rehab therapists, they'll see case managers, social workers, as well as neurology.
The healthcare team doesn't stop with the physicians and the advanced practice providers. We have an enormous multidisciplinary team, including pharmacists, speech-language pathologists, physical therapists, occupational therapists, specialty neurocritical care and nursing, an entire team whose entire focus is the brain.
We know that one of the things that can help patients recover the most is getting access to inpatient rehab, so that's always a potential option for patients when they are hospitalized with a stroke.
The continuum of care is incredibly important, especially for stroke patients. We take great pride in having a MedStar Stroke Clinic facilitated by our in-house stroke NP, as well as a partnership with MedStar Good Samaritan for acute rehab. Our follow-up phone calls are incredibly important in those 90 days because it ensures that patients are able to be compliant with their medications and understand their medications, as well as follow up and schedule appointments with their doctors. It also gives us time to rehash the signs and symptoms of stroke and connect them with our stroke support clinic if need be.
At MedStar Franklin Square, our metrics for removing the blood clot from the brain, or thrombectomy for a stroke, are some of the best in the state. We can remove the blood clot out of the brain 94% of the time. That's higher than what the national standard is, and that's higher than most of the places in Maryland that are performing this procedure. Because of this, we want to offer our services to not only our current community, but beyond this community to the entire state of Maryland.
We are aware of kind of advances in novel and new treatments, and one of those is a new treatment for that clot-busting medicine called tenecteplase. That really offers us the ability to provide that medication in the fastest time possible with kind of the least intervention to the patient compared to the prior medications. Removing those clots as quickly and as safely as possible is the best we can do for patients who are coming to MedStar Franklin Square with an acute ischemic stroke. And we've been proud to share that we have won a number of awards from the AHA recognizing the achievements we've made.
Another example of one of the sophisticated treatments that we offer at MedStar Franklin Square is the ability to perform minimally invasive craniotomies to treat cerebral aneurysms. These procedures involve a very small incision around the face or the head where we can use small entrances to access the blood vessels that lie at the base of the brain and treat aneurysms to prevent them from bleeding. Another example of an advanced procedure is cerebral bypass, which is an operation in which the small blood vessels of the scalp are carefully sutured onto the blood vessels over the brain's surface, which is helpful in improving blood flow to the brain in serious but rare conditions such as moya-moya disease. I'm proud to say that MedStar Franklin Square is one of the few hospitals in the country that offers this type of advanced surgery. We're fortunate that MedStar has made a tremendous investment in our ability to obtain new technology. That means that we can use new catheters and devices to improve outcomes in our patients, and we are now participating in various clinical trials examining which devices might be better for our patients moving forward.
Continuous EEG is one of the main reasons that we receive transfers from outside hospitals. Continuous EEG monitoring lets us find and treat seizures in real time 24/7. 365 days a year.
In 2021, MedStar installed a state-of-the-art biplane machine here at MedStar Franklin Square Medical Center. What it is specifically is the use of low-dose X-ray to visualize the blood vessels in the brain and the spine at the highest resolution possible. We use this minimally invasive technology to perform cutting-edge procedures. Specifically, we can go up through the blood vessels, we can remove blood clots, we can treat aneurysms from the inside, we can actually treat many complex neurovascular diseases of the brain and spine in addition to just your basic strokes as well. Trainees and residents have access to our diverse population of patients here, and they're coming to MedStar Franklin Square Medical Center to learn not only from faculty, but our patients as well. These are the next generation of doctors, and they're learning from us.
I think one of the things that sets MedStar Franklin Square apart is that our providers are not just amazing providers, they're exceptional people. I feel so much pride in my day-to-day job because of the collaboration I have with the multidisciplinary team, as well as the fact that no matter the title of the staff members within the hospital, everyone is educated on how to recognize signs and symptoms of stroke.
I'm incredibly proud to be a part of the team at MedStar Franklin Square, where highly trained physicians are working in close collaboration to provide the best possible care for our patients.
And being able to provide comfort to those patients and families and giving them a sense of hope and understanding of what the direction is and what the recovery process is really a privilege in order to be part of that patient's life and the family's life during that time.
We have developed something here in a very short amount of time that's an achievement for everybody involved. It is a major milestone, not only for the hospital and the community, but for MedStar as a whole and the state.